This is kind of hard. Okay, my table. I will be doing a quick brain dump before starting my video. Hi, my name is Danielle. I'm going to be your student nurse. Can I get your first and last name?
Anna Hardyman.
And your date of birth?
June 17, 2004.
Okay, I'm going to check your wristband. And looking at provider's orders, it looks like we have a skin assessment. Is that okay?
Mm-hmm.
I am going to provide privacy, and I have performed hand hygiene. I'm going to be wearing gloves for this assessment while palpating different areas of the skin. Okay. Do you have any skin allergies?
No.
Do you have any new lesions or bruises?
No.
Do you have any new rashes or eczema?
No.
Okay. First, I'm going to look at the face. I'm looking at the lips. I'm looking at the sclera of the eyes. Sclera is white. Can I have you pull your eyelids down? Conjunctiva is pink. I'm going to have you open your mouth. Mouth is pink and buccal mucosa is moist. I'm looking at the skin. I'm looking at the color. I'm looking for any lesions, abrasions, or bruises. And I'm inspecting for edema. I'm looking at the nails. Looking at the contour and shape. And I'm going to palpate the skin. At first, I'm going to palpate looking for any edema in any areas of the skin. No signs of edema. If there were, trace edema is minimal depression with instant return. +1 is 2 millimeters depression with rapid return. +2 is 4 millimeters depression with 10 to 15 seconds of return. +3 is 6 millimeters depression with 1 to 2 minutes of return. And +4 is gross edema, which is 8 millimeters depression and 2 to 3 minutes of return. I am now going to palpate the nails, doing capillary refill and feeling for texture. Capillary refill was instant and the texture of the nails was smooth. And then the toes, capillary refill was instant and the texture is smooth. I'm now going to palpate the skin, feeling at the temperature, texture, temperature and texture, making sure that it is equal bilaterally. Good. Texture was the same throughout the body and equal on both sides, and the skin is smooth, no dryness or excessive moisture. I'm going to palpate the skin turgor. If it was an infant, I would do it on the abdomen, or if it was an elderly adult with excessive skin on the hands, I would do it on the chest near the clavicle. Palpating the skin turgor, it returns immediately, meaning that there's no signs of dehydration or malnourishment. I'm going to take off my gloves and document my findings, perform hand hygiene. I am looking around the room, making sure that there's no risk for falls, making sure the bed is lowered and locked, call light within place, and bedside table within reach. Is there anything else I can do for you today?
No.
Are you comfortable?
Yes.
Do you have any allergies?
No.